Governor Newsom announced today the state again saw its highest jump in daily cases since March, more than 7,000 cases. Also up, the number of hospitalizations and the number of patients in ICUs. He said that's why it's so important that everyone wear a mask and social distance.
We cannot continue to do what we have done over the last number of weeks.
A sobering warning from Governor Newsom as the number of coronavirus cases hit record levels.
Many of us, understandably, developed a little cabin fever. Some, I would argue, have developed a little amnesia.
The governor wants Californians to go back to their early efforts following state guidelines of social distancing, wearing face masks, and washing their hands.
People are losing their lives to COVID-19, and we are seeing an increase in the total number of cases with people that are getting younger and younger.
He spoke specifically to young people.
There is a sense that a lot of young people are, well, you're young, and so you feel a little bit more invincible. But respectfully, often that can be a selfish mindset.
The governor's appeal comes just a day after the state health department reported more than 7,100 new cases, shattering the previous single-day high of just more than 5,000. Ventura is one of the counties that has seen a spike. Up until now, Ventura had consistently been reporting low numbers.
It is very disappointing to see this happen.
Dr. Robert Levin is the county's public health director, and while many have claimed the increased number of cases is the result of increased testing, he says there's a better way to gauge.
There is a solid number that, whether you've been tested or not, is tried and true to reflect the true amount of COVID-19 in the community, and that is the people who are getting sick and sick enough to be hospitalized. That's the number we look at.
The number of hospitalizations is a true sign of the uptick, which has risen to 5.1%, a 29% increase over the last 2 weeks.
Governor Newsom also threatened to withhold up to $2.5 billion to counties in the upcoming budget if they don't comply with the state mandated health restrictions. He said the money will be paid out on a monthly basis, not annually, to make sure they're all sticking to the plan.